Hello and welcome to How to Have a Good Future with Kidney Disease. Today we'll be talking about your money and your life. Hi, I'm Mary Beth Callahan. I'm a kidney social worker, which is also sometimes known in the dialysis and transplant world as a nephrology social worker. Currently, I work at Dallas Transplant Institute, but I started out working with kidney patients and families 32 years ago, working with peritoneal dialysis patients and hemodialysis patients, and so it's been a privilege to work with people through these years, and it's really nice to be with you here today. So thank you for joining us. Thank you for tuning in. Kidney disease can be costly, but today we want to talk about ways that you can understand that there is help now that is certainly better than there was available to people back in the 1960s, when there was really not help in terms of payment for people who had kidney disease, and it wasn't even possible to help people with treatment for kidney disease prior to that. Prior to that, the treatments were considered experimental, and most insurances didn't pay for dialysis, and it was extremely, extremely expensive. That meant that most people could not get this life-saving treatment. And even though dialysis is still expensive today, now there is help to pay for it. And we'll talk about some of those ways to pay for it during our discussion today. So, if a person has an employer group health plan, which means that either they are working or their spouse is working or their partner is working, the employer group health plan would be the first payer for the first 30 months of their time when they have either a transplant or started dialysis, with a little caveat that we'll talk about later. Medicare pays first if a person doesn't have an employer group health plan. And nowadays, we have a lot of individual plans under the Affordable Care Act, and these pay after Medicare but do not necessarily coordinate with Medicare. So again, Medicare would be the primary payer, with an individual plan being after that. Other payers may include Medicaid, and sometimes people get Medicaid and Medicare confused. Unfortunately, they both begin with the word Medi, but they're very different, and we'll talk about how they're different. But other payers include Medicaid. People may get benefits through the VA, the Veterans Administration, or the Indian Health Service. Additionally, Medigap plans, which are also sometimes known as Medicare supplements, can pick up what Medicare does not pay. But first, let's talk about Medicare for a little bit. And I am the first to tell you that understanding all the rules about Medicare can be very confusing, and I certainly don't understand all the rules about Medicare, but I try to understand all the rules about Medicare as they relate to people with kidney disease, because that's the people that I work with. Medicare is a national health insurance plan, and to qualify for Medicare, a person has to earn credits toward Medicare by working and paying taxes. So you have to qualify for Medicare by having enough credits for your age, and there's a schedule that Social Security and Medicare have worked out in terms of how many credits a person needs according to their age. Once a person gets Medicare, it's not just for kidney disease. So whether a person has Medicare as primary payer or secondary payer, Medicare pays for any disease process, or if a person breaks their foot, or if a person has a cold. So it's not only for kidney disease. But backing up just a bit, there are three ways that a person can get Medicare if a person has enough credits. So we are probably most familiar with the idea that people over 65 are usually eligible for Medicare. A second way is if a person becomes disabled 24 months after the person receives their first Social Security disability check, that person becomes entitled to Medicare and begins receiving Medicare. The third way is through kidney failure at any age. But again, the person has to be able to have enough credits on their own or through somebody else to qualify for Medicare. So in some cases, a person may draw credits on their husband or wife, from their husband or wife, or in some cases, a child might draw off of a parent's Medicare credits. And when this happens, it doesn't take away from the other person's credits. Those stay intact. But the person with kidney disease can draw upon those and get Medicare in place. So there are four parts to Medicare. And we're going to briefly explain each one of those parts. Part A is for hospital care. That's what most of us would use it for. It's also for hospice or skilled nursing facilities. Part A does not have a premium if a person has worked and has enough credits. If a person doesn't have enough credits, there is a way to buy into Medicare Part A for a premium. Generally, the cost of that premium is high, and most people don't fall into that category, but that is a possibility. Then there is Part B, as in boy. Medicare Part B has a premium and is based on income. For the large majority of people, there is a base premium. And in 2015, the base premium is $104.90. Now, for people who have a higher income, there is an increase on that premium. And this year, the highest amount of premium on Medicare is $335 a month. Generally, Medicare Part B as in boy premiums come in quarterly premium statements. And so that can be hard for people to pay in quarterly amounts. There is a way to pay these premiums on a monthly basis, and that's something you may want to ask Social Security about if you are applying for Medicare. Then Medicare C, which we really never refer to as C, but C is all about Medicare Advantage plans or managed care. And sometimes if people have a Medicare Advantage plan before their kidneys fail, they're able to keep it. There are also some special needs plans that will accept people whose kidneys have failed. There are some advantages and some difficulties with Medicare Advantage plans. And so this is something that you want to look at very carefully. Medicare Part D is the prescription drug plan that you hear a lot about every year, because every year a person is able to change the Medicare Part D prescription drug plan that they have. And so you'll see a lot on TV in terms of advertisements about this. The Medicare Part D plans vary in premiums depending on which plan a person purchases. And these are administered through insurance companies across the nation. And these also include national plans and state plans. And so if a person has a Medicare Part D, as in dog, or drug plan in one state and they move to another state, the Medicare Part D plan may well need to change because they are moving from one state to another. Part D has many complex copays and deductibles, and this is something that you can look at if you go to the Medicare.gov website and Google Find Plans. There will be information for you there to look at this. If someone has coverage from an employer group health plan, you would normally not want to get a Medicare Part D drug plan because you have insurance that is what's considered as good as Part D. And so you would not want to get a Medicare Part D plan. In fact, there could be some negative things that happen if you got a Part D plan and you had an employer group plan and your employer stated that you were not eligible to get a Part D plan while you had their employer group plan. So there are all types of rules, and you want to be aware of these and know what's going on. On the other hand, if a person chose not to get a Medicare Part D plan when the time came because they think that they're not on any medications right now, there is a 1% penalty per month for delaying enrollment. And this penalty is added onto the Part D drug plan premium forever, and there's no cap on this. So again, there's a lot to know about Medicare, and I certainly don't claim to know everything, but I think the idea that I want to give to you is that you want to ask a lot of questions. Now, as we talked about, Medicare Part B as in boy has a premium, and sometimes it's difficult to pay for two insurance premiums, particularly if you have an employer group health plan. So there's no easy or right answer for everybody. But sometimes having Medicare Part B as in boy can save a person more money than the premiums cost. It's very hard. One of the things that can happen with chronic disease of any kind, but I think since we're talking about chronic kidney disease, is that the bills and the cost add up over time, over a number of years. And so sometimes by the point that a person is maybe thinking about the need for dialysis or transplant, it's not like the first time that they've gone to the doctor for appendicitis. There have been a number of bills that may have stacked up already in terms of medical bills. So it's not easy to make these decisions. But Medicare Part B can have some advantages. It can limit what dialysis providers charge you or other providers might charge you. And having Medicare Part B can also protect you in case you lose your employer group health plan. And losing your employer group health plan can come about for different reasons, whether that be you might become too ill or because of a layoff. You know, many, many years ago, and I've been doing this long enough to use a lot of hair coloring, but many years ago, COBRA, which is an extension of coverage after a person loses employment, was, even though it was always expensive, it was at a point that was affordable for people, and maybe it could be used. But nowadays, COBRA is usually so expensive that it's very difficult for people to think of that as a real option. So in the back of your mind, if you're thinking that I'm not going to get Medicare Part B as in boy because I'll just take out COBRA if I lose my job, I would encourage you to price out what the cost of COBRA would be through your company as you make that decision. So to summarize, carefully think through applying for Part A and not Part B. There are many rules that apply if you choose to apply for Part A only and not Part B. And I'd encourage you to be sure and talk about this with someone that understands what's in your best interest and someone that is very knowledgeable about this area. There are a couple of things, as we talked about. You could end up with a coverage gap, or you may end up having to pay a higher Part B, as in boy, premium later. So let's talk a little bit about what Medicare pays in terms of transplant or dialysis. If you have traditional Medicare, so this means not a Medicare Advantage plan, but traditional Medicare, Part A pays 100% for your transplant surgery and hospital stay. That is, after a deductible for Medicare Part A is paid. Currently, the Part A deductible is about $1,200. Now, again, there are many rules about Medicare, but the Medicare Part A deductible is not one time a year. The Medicare Part A deductible is per every 60-day hospital admission. So if a person goes into the hospital 5 times during a 60-day period, there's only one hospital Part A deductible. However, if they go in 5 times during that 60-day period and then they go in on day 64, there is a second hospital deductible. So there could be as many as 6 Part A hospital deductibles in a year with Medicare Part A. Now, we would hope that you wouldn't go into the hospital 6 times during a year, equally spaced 60 days apart, but I think it's fair for you to know that that's a possibility. Additionally, traditional Medicare Part A pays for the living donor evaluation, surgery, and hospital stay. So if Medicare Part A pays for that, what does Medicare Part B pay for? So traditional Medicare Part B, if it's primary, will pay for 80% of doctor fees and outpatient services, as well as transplant medications, the anti-rejection drugs. Again, that's if Medicare is the primary payer. It will pay for 80%. So if you're going into the hospital for transplant surgery, yes, Part A will pay for your transplant surgery and the hospital stay, but all those doctors that you see while you're in the hospital, the surgeon, the anesthesiologist, the radiologist, the nephrologist, those are doctors that will be also probably sending you a bill for the 20%. And if a person has Medicare based only on kidney disease, then Medicare will end 3 years after transplant. An employer group health plan may prefer certain transplant centers. Sometimes we consider this based on managed care contracts. Sometimes these are considered in-network or out-of-network. And sometimes transplant centers are considered centers of excellence. So it's important for you to be aware of these things because in the end, the cost may be different for you. So ask these questions to see if your employer group health plan prefers a certain transplant center in your area. And now Medicare also pays for 80% of the allowable cost for dialysis. And we'll look a little bit more specifically at that in just a minute. But I also want to say that in terms of living donors, Medicare will generally pay for a donor follow-up for 3 months after surgery. So Medicare, even though they'll pay for the donor surgery and evaluation, it doesn't cover the donor forever for any problems that might arise related to giving the donation of the kidney. If something occurs for the donor within that 3-month period, or maybe a little over that with review, it can be up to 6 months. But I think that's maybe important for people to understand as well. And we talked a little bit about this, that Medicare would pay for the full cost of care for a living donor, but it is also occasionally necessary for a donor to take antibiotics or pain meds, and Medicare does not pay for that for the donor. Those are not usually a lot, but sometimes it's just important to know that. And separate deductible or coinsurance is not paid for the donor. Now, Medicare does not pay for donor travel or time off work. And again, I want to just impress upon those listening that Medicare will end 3 years after transplant unless the person is over 65 or disabled for a reason other than kidney failure. Social Security, for those of you who might in the future receive Social Security disability, considers transplant potentially disabling for 12 months. That means that any time after 12 months after transplant, if Social Security reviews you and you do not have a disability other than kidney disease and your kidney is working, then your Social Security disability benefits could stop at that time. Medicare would continue for 3 years. After Social Security stops, you would pay for the Medicare premiums. While you have Social Security disability, the premiums would be taken out of your Social Security disability check. Therefore, it's important to be thinking about how am I going to pay long-term for my health care costs and my medications. And I just want to plant a little seed that Social Security has special work incentives that can extend a person's Medicare. So if a person is transplanted and is doing well, and they are able to return to work before Social Security reviews them 12 months after the transplant, they can complete a trial work period of 9 months. This is the first work incentive from Social Security. And currently, the trial work period is completing 9 months at $780 a month gross. This changes every year, and this is 2015. I'm going to give you a website to look at. So if a person completes a 9-month trial work period, and during that 9 months, a person can make $2 million a month, but to qualify as a trial work period month, you have to make at least $780 a month gross in 2015. Then, at the completion of the 9 months, it activates a second work incentive from Social Security, which is the continuation of Medicare for 7 years and 9 months from the end of the trial work period. And so that's very important for consideration in your long-term planning. Now, to find out more information about that, I would refer you to www.ssa.gov. That's SSA as in Social Security Administration.gov, and go to the Red Book. and then search Social Security Disability, SSDI, work incentives. So I just wanted to share those thoughts with you. So what do you pay for a transplant? These are some of the things to think about. These are with traditional Medicare. Cost with Medicare Advantage plans may be different. And remember that Medicare doesn't pay for donor travel or room or board. There are other programs from nonprofit organizations that can be pursued from your transplant center that can help with that. But there's going to be the deductible that we talked about, travel to and from the transplant center and follow-up visits after transplant, 20% copays for transplant medications if Medicare is your only insurance, copays on other medications, time off work. That can be for the patient who's getting the transplant and for the caregivers as well. So hopefully you will meet with a social worker during your pre-transplant evaluation process to help you plan individually for what these costs would be for you. And I encourage you to do fundraising with reputable organizations to save money for your post-transplant needs. A couple of these organizations are the National Foundation for Transplants, Help Hope Live, and Children's Organ Transplant Association, COTA, C-O-T-A. And COTA is available for adults also with polycystic kidney disease. Otherwise, COTA works with families with children. Now, Medicare payment for transplant medications, just talking a little bit about that. A person has to have Medicare Part A in place either at the time of the transplant or retroactively get it in place. Sometimes a person will have an employer group health plan that covers the cost of the transplant, so they're not eligible for Medicare until the time of the transplant. Medicare allows that person 12 months to get Medicare A in place that covers the date of the transplant. However, the transplant center has to be a Medicare-approved transplant center, and so I want to make a very clear statement that any transplant center outside of the U.S. is not a Medicare-approved transplant center, and Medicare Part B, as in boy, will never pay for the anti-rejection drugs if a transplant is done outside of the United States. So Medicare Part B, under the current rules, would never pay for the anti-rejection drugs. And currently, they would pay for 80% of the cost of the anti-rejection drugs. And if a patient had a Medicare supplement, the Medicare supplement would pay for the remaining 20% when a Medicare Part B as in boy pharmacy was used. Again, a transplant center social worker or coordinator would be able to help you set these things up. When Medicare is primary, it pays 80% of the allowable cost for dialysis as well, and it pays for dialysis at home or in a clinic. Medicare routinely pays for 3 hemodialysis treatments per week, and these can be during the day or the night. Now, with a doctor's letter, Medicare may pay for a 4th hemodialysis treatment. And most clinics are able to work with short daily hemodialysis treatments, and the money that they receive are able to make 4 treatments paid for as well. You also need a way to pay for the other 20% that Medicare doesn't cover, and this can be difficult. When Medicare is secondary, it may or may not pay, but having Medicare means that the clinic can't charge you more than the Medicare rate if your employer group health plan paid at least 100% of Medicare's allowed rate. Now, this is all somewhat complicated, and we're giving you a lot of information. The nice thing is that you can refer back to this multiple times if you need to. Here's kind of an example of what the cost of dialysis can look like when a person has Medicare. It can look different when a person has insurance through an employer group health plan. But under the Medicare bundle rule, each person pays a different rate. The cost per treatment is based on a person's age and their illnesses. And as you can see, the 20% the person must pay can add up to thousands of dollars each year. And so that's why it's important to have a secondary payer, if possible, a Medicare supplement or a health plan. Peritoneal dialysis is paid at the same rate as standard hemodialysis, $250 times 3 a week, if Medicare is primary. It's also important to know when Medicare starts to pay for dialysis, especially perhaps as you're thinking about what treatment fits your lifestyle. It may help you decide which treatment is best for you. If you start training for home dialysis, which can be hemodialysis or peritoneal dialysis, or in-center self-care, before the 4th month of dialysis, Medicare starts on day 1 of the month you started dialysis. Then you would only pay 20%. However, if you start in-center treatment, Medicare won't pay until the first day of the 4th month. Therefore, the first 3 months you have no coverage, and you would be responsible for 100% of the bill. Now, your health plan will pay for all or some of this if you have one. However, I think more and more we all need to be aware of deductibles and how they play a part in our medical care. More and more I see in our patients' insurance what we call integrated deductibles. And an integrated deductible is when medications or doctor visits or hospital visits, nothing gets paid until your deductible is met, whether the deductible is $1,000, $3,000, or $5,000 or more. An integrated deductible means nothing is going to get paid until your deductible is met. And remember, this is on a yearly basis. So that is a very important item to check. If you or your spouse is working and you have options regarding employer group health plan benefits, check to see if your deductible is an integrated deductible or not. And sometimes it's very hard to find that information because for the majority of people, it's probably not that big a deal. For people who are transplant recipients, it's a very big deal because if the integrated deductible applies to medications, that's going to be a big problem every January or September or whenever your insurance calendar year begins. When you don't have Medicare yet in place, clinics can charge you commercial rates. This means that you could owe many times the amount that we've talked about, which could be over $10,000 a month. There's a free online Medicare start date calculator at www.homedialysis.org/home-basics/calculator. That might be helpful for some folks. Now, what is Medigap? And again, in all these Medicare insurance terms, nothing is real clear-cut, so Medigap is also called a Medicare supplement. But I like this slide because Medigap helps us bridge the gap between what Medicare pays and what you owe. Medigap plans bridge this gap. Every state requires insurance companies to offer Medigap plans to those over 65 for 6 months after they get Medicare Part B. So for 6 months from the effective date of your Medicare Part B as in boy, you can get a Medicare supplement if you're over the age of 65. Some states also require insurance companies to offer at least one policy to people under 65. You can also go online at Medicare.gov and get information on what states these are. Now, we're going to talk a little bit about Medicaid as well. And Medicaid is based on income and resources or assets. It's different from Medicare because anyone who has worked and paid work quarters and is a U.S. citizen can get Medicare. But if a person's income is higher than a state's allowed amount, they will not be eligible for Medicaid. Or if they have more money in the bank or 2 cars or a boat or something like that we call assets, they won't be entitled to Medicaid. So this varies by state. But all states must cover some services under Medicaid, which include dialysis. Many of the states now are going under what's called Medicaid managed care. So the state may not just have traditional Medicaid, as was the case maybe 5 or 10 years ago, but insurance providers take over portions of the Medicaid population in states, and so different companies would have, you would choose as a Medicaid recipient which insurance company you wanted to go with in many states. Now, the other thing that happened under the Affordable Care Act is that some states chose to accept federal monies to expand into Medicaid so that all people in their state could be covered for health care. And some states chose not to expand into Medicaid or to accept Medicaid monies. So for states that did not accept Medicaid expansion monies, people who make under a certain amount are not able to really afford insurance under the Affordable Care Act because they are not able to get a tax credit for the Affordable Care Act. You really have to be able to show earned income of a certain amount before you're eligible for a tax credit, or you pay the full amount of the policy. But if you are in a state that expanded into Medicaid under the Affordable Care Act, then if you don't meet that criteria, then you can get Medicaid in that state. In Texas, for example, that did not expand into Medicaid, people, for an individual who makes under $12,000, but that's over the amount that they would be eligible for Medicaid in the state of Texas, would be left without health coverage. They would need to go to a health clinic in the community. And so it's really hard to piece these things together sometimes. You can find out more about this by going to www.C as in cat, M as in medical, S as in Sam.gov, G-O-V, /Medicaid eligibility /. So, all things considered, if it's possible to have a job, it's best to keep it because having an employer group health plan is probably the best way to be able to have a second health plan. And if you have one, remember as we talked that this plan will pay first for the first 30 months that you're eligible for Medicare. After that, it will pay all or part of the 20% balance after your deductible is met. Most people don't necessarily know that they'll maybe lose as much as 2/3 of their income if they decide to take disability. And unfortunately, we all probably do realize that our bills won't go down just because a person has kidney failure. The other thing that I think is very important to consider is that if you have the opportunity to purchase short-term disability or long-term disability, and I would ask you not to just assume that it's not possible because you have kidney disease, please look into doing so, because when a person is eligible for Social Security disability, the person has to be without earned income for 5 months before they begin receiving a Social Security disability check. Social Security disability has 2 parts to it. There's the medical component. Does a person satisfy the medical component of being disabled? But there is also the earned income component for Social Security disability. So for most of us, it would be really very difficult to go 5 months or 6 months without income waiting for the disability check to start. So again, if you have the opportunity to sign up for short-term or long-term disability, take it. The other thing is, if you need time off work to adjust to dialysis or to recover from a transplant, take a temporary leave. Remember that there is something called the Family Medical Leave Act, FMLA, that most people would be eligible for and apply for that. The other thing is that I see that most people want to delay the start of dialysis, and yet usually after they start dialysis, they really feel so much better because they have been gradually feeling worse and worse over a long period of time. So I'd like to encourage you to make a decision about stopping work after you give yourself a chance to feel better. The other thing that's happening sometimes is that people are feeling very tired and maybe feeling too tired to work due to anemia. Anemia is a shortage of red blood cells, and most people with chronic kidney disease have anemia, but only 1 in 4 are treated. So if you're feeling tired, cold, and have a fuzzy thinking feeling or no energy or other symptoms, see your doctor and ask for a blood check for anemia, because anemia can be treated so that you have more energy. You may need iron as a building block for red blood cells, and then your doctor may prescribe an ESA. The E stands for a big word that I have trouble pronouncing, but it's erythropoiesis stimulating agent to tell your body to make more red blood cells. ESA drugs do have some risk, but they have many benefits. So you and your doctor can sort out what's best for you, but it's at least worth checking on this. And I would also suggest that our last slide will refer you to a website called lifeoptions.org. And on that website, there are some very good, easy for me to read fact sheets. And one of the fact sheets talks about anemia, and I would suggest that you might think about that. That's lifeoptions.org. So again, treating anemia gives you more energy. It can often take about 6 weeks to feel the improvements of anemia treatment, but once the treatment starts working, you'll likely feel much better. And at that point, you may think, I could have really kept my job. I could have kept my health plan. I wish I would have delayed my decision about quitting my job. And so I just encourage you to delay quitting your job until you give your body some time to stabilize after you get anemia treatment and maybe some dialysis. Don't let kidney failure stop you from feeling or staying active. It's good for you to move around and get some exercise, and it's good from a physical standpoint, but it's also good from a mental standpoint. Now, it is very important that you speak to your doctor so that you are sure that you're exercising safely and at the right level for yourself. But it helps our body to work better if we are able to stay active. And, it helps us to be stronger and more flexible. It keeps us more steady on our feet very often. Sometimes when we've been declining a bit in physical function, a physical therapist, which is usually paid for by Medicare or our insurance, can help us kind of get a start on things. And I really encourage that if you've been down for a bit. But getting active just can help us in so many ways. Where I work in a big square, and I've seen one of our doctors. He always makes the entire square instead of going the shortcut. And so now I've started going the entire square so that I can just stay more active during the day besides additional activity in terms of exercise. So there may be ways that you can do tricks to remain more active as well. I liked this thought that some people think their bodies are like flashlights. Um, they're, if you use them up, if you use up too much energy, then it's gone. But that's not so. Your body is more like a rechargeable battery. And I know sometimes that it's very, very hard to get up and do something because it's so much easier to stay on the sofa or stay in bed than to get up. And some of that may be from anemia. Some of that may be because, we're feeling down. We're feeling a bit depressed. We're feeling like it's just better to crawl under the sheets. But I want to encourage you to try and get up and do something. You can get stronger at any age. 80, 90, or 100. I remember going for a walk with my Aunt Mabel, and she was in her early 90s, and she had a walker that was kind of built like a bicycle, and I thought, well, certainly I'm going to be able to keep up with her, but actually she got to moving really fast, and I could not keep up with her without getting in a kind of short of breath, so that showed me what I needed to be doing. But anyway, studies show that you can build muscle and get stronger at any age, and so we really need to force ourselves to be aware of that. Sometimes it takes finding something that you enjoy doing to try and make being active play and not work. So maybe there's a sport that you enjoy doing. Maybe there's something that you previously enjoyed but can't do anymore. Is there a way to do a part of that, to be involved in some way that could help you feel connected as well? Maybe it's gardening. Maybe it's dance. I like to dance. My husband doesn't like to dance, but I can Zumba without him. So these are just a few ideas. There are many more. Think back to what you loved to do as a kid. Sometimes that brings us an inner joy that maybe we have left aside for a while. That may help you come up with ideas of what might be fun now. And walking is a great exercise, and it's free, and sometimes it's cool enough to do it wherever you might be. So I ask you to think about what to do to stay fit, what sort of things you might enjoy, and just think of one thing that you might talk over with your doctor to see if you can do the next time you visit with them, something that you can do in the next week or month. So, just 50 years ago, if a person's kidneys failed, medicine really couldn't save them. But today, you get a new start with kidney treatment, whether that's dialysis or transplant. This is extra life that you wouldn't have had before. Make it count. You really can have a good future with kidney disease. Do some of the things you always meant to do, but didn't get around to doing before. Think about what you want to have in your life. Make a plan. Follow your dreams. Try to reach one of your goals and recognize and celebrate the small steps you take towards that goal. Enjoy the present. Enjoy the process of getting there, not just the goal. How do you reach your goals? And, we all have to take one step at a time, but the journey can be worth it all by itself. Break the goal into smaller steps that allow us to have the courage to get up off the sofa and walk around the inside of the house where we might be able to start getting our stamina up. Think about who could help you. When do you want to get started? And how will you reward yourself for making progress? Will you think about a goal that you would like to set? The other thing I'd like for you to know is that dialysis clinics and transplant programs must have a social worker with a master's degree on board. The social worker has training to help you adapt to your treatment. He or she may also be able to help you with money concerns, to help you think of ways to adapt to your situation. They can also help you set goals and move toward a life plan. So we've talked about a lot today, and feel free to listen to this webinar again and again. But some of the takeaways are, if you have kidney failure now, there's help to pay for treatments, and usually Medicare is one of those options. You can still end up with a big bill, though, and especially if you're moving towards transplant, please consider doing fundraising. Knowing how your choice can affect how you can help you avoid surprises. If you have a job with a health plan, keep it if you at all can. Don't make decisions based during the time that you're feeling your worst. And do something you enjoy to stay active. Think about what your goals are and make a plan to work toward them. When we're going through chronic disease, sometimes we have to tweak our goals a bit, but we still need to stay in that forward motion. Let's use this time to have a good life, and remember that your social worker is a resource for you. Here are some websites. The Life Options website that I spoke about is the second one. I also referred to the first one, homedialysis.org, and there's just a wealth of information on this page. But I want to leave you with a thought that I have had the privilege to work with patients for over 30 years now, and from my experience, and as I say, it has been a privilege and a blessing, I know that you can have a good future with kidney disease. Thank you for being with us today.